with some other information. Well, as many as 41 people have been injured in the Nepal floods, and they are currently undergoing treatment across several hospitals. Now, the Tribhuvan University Teaching Hospital is treating the highest number at 20, followed by the Trauma Center with 4 patients. The Bed Hospital is treating 3, while Birendra Military Hospital, Grande City Hospital and Trishuli Hospital are each treating 1 patient, and the Norwich Hospital is treating 3 more. So, well, Brian, this is another aspect of this particular disaster, the people who have been injured, because there are hospitals across the region treating them, but obviously they are facing a lot of issues. The roads to these hospitals, the access to these hospitals are cut off. We are also looking at electricity being cut off in various areas of the region. We are looking at communication lines which are down. So, the doctors also dealing with a lot of logistical issues while they are treating these patients.
Well, Shivani very rightly pointed, if you remember in the early bulletins, we were discussing that, we are talking about more than 19 bridges collapsing, 40-kilometer stretch of roads completely destroyed, devastated with the flash floods. And as a result of that, many of them are connecting towards different parts of the cities. And obviously some are connecting towards the hospitals. Now to reach nearby hospitals is becoming a task for obviously the people who have been injured in the flash floods itself. Many of them who are at this point of time grieving with losses of the families, or even of the fact that they are injured. Not just that, even it also spreads a risks of many diseases also, with at this point of time roads getting over flooded with water at this point of time, rivers, the very bridges being collapsing. And at this point of time, when the people are also in shelters, they're trying to even make temporary shelter homes. Aids are being offered to the people who are in dire need of aid at this point of time. Chitwang, as we were speaking about, since it is in the lower lying area, the one that faced the major wrath of it, and people also of Chitwan are clearly they want some kind of help, they want some kind of relief. They are making their own temporary shelter homes to stay there. There is an uncertainty of water itself, of the basic aid at this point of time. Many of them are homeless at this point of time, because obviously their homes, their houses, residential properties, buildings are all washed away from the flash floods itself. And at this point of time, people with children, people with kids, people with elderlies are all trying to stay near the mountains, near the caves that is being built, which is also very risky at this point of time, because with the landslide, there can be a probability of landslide also that can be extremely risky. So, we are talking about so many aspects that is extremely difficult, dangerous and devastating as well, Shivani. Yes.
Absolutely. Stay on with us, Brian. We have some more information coming our way. The visuals are emerging from the Nepal flood zone, which